Her dad was a police officer. My mom worked for the police department for 22 years, and she's also a politician in Chapel Hill. But to have a son and to know that having a family involved in military, law enforcement, and we still don't feel safe. And to me, that's ridiculous. I get scared every single day. When I drive, I take my time. I know you should take your time, but I don't do it because of other drivers. I do it because I'm scared of getting pulled over. I don't know what's going to happen to me. It's almost like I don't know what to do. They say do it this way, and someone dies. You say, okay, well, you shouldn't have done that. We do it this way. So it's like, okay, but everybody that's dying looks like me. So what do I do? And that's what's scary. And like my wife said, I don't want to have to worry my son gets older and the first time he gets in the car and gets pulled over, something happens.
And my father was a police officer in Richmond, Virginia. That's where I'm originally from. And one of the things he said before he passed away a few years ago, when I asked him, Dad, what is different now? Because when you were a police officer and we were growing up, we didn't have as much fear as we do now. And he said that when he was in the academy and when he finally became an officer, that officers were more so about community. The community members knew him on his beat, that he would walk with his K9. And he actually took a moment to get to know who he was protecting. There shouldn't be a spirit of fear that the people that are supposed to be protecting us are the ones that are killing us. Myself, I am diabetic. I have a family that has several people in it with diabetes and high blood pressure as well. So to relate the two, unfortunately, it almost seems like police brutality and injustice could potentially wipe us away faster than those diseases.
The research shows us that racism in America contributes to enormous health inequity. From the moment of birth, you are more likely to die if you are black in this country than if you are white. You are less likely to have high quality education, access to health care, financial advancement, and all of that leads to worse health outcomes, mortality, chronic illness, disability, and it's due to systemic racism in this country. Response to them needs to elevate and care for those people who are most at risk, and that includes people of color, and so more work needs to be done to care for them.
Well, there's definitely a disparity amongst African Americans as it relates to health care, and given the amount of added stressors that are going on right now in the midst of a pandemic and injustice, it just adds to that already weighted thing that we deal with. And there's also a level of distrust when it comes down to seeking adequate health care and being offered what is considered adequate health care. There's still many African Americans who are uninsured and who would love to seek health care but don't have the resources. And when you go against a system like the Affordable Care Act that would help to insure people so that those of us who deal with those stressors, those added stressors on top of just living as an African American, when you take that away or when you jeopardize it or compromise it, it even makes it worse. So it's almost like you're spinning your wheels in the mud, so to speak. So
women say that they're scared to come to the hospital.
Why is that?
Because they're wondering how they're going to be cared for, if they're going to be cared for. I think that, this has been going on forever, but now women know about it more. So they're apprehensive about how we will receive them and how we will listen and whether we will listen when they come to the hospital to have their baby, or if they're having a loss or some other complication in their pregnancy.
Right. What do you do? How can you reassure them, or is that possible?
Can't really reassure them completely. I can just do what I do, and I can try to ask the right questions and mostly be quiet and listen and make sure that the staff that I'm working with are on the same page. But I can't have complete control of all of the providers. This is such a pervasive problem.